Hi, thank you so much for watching my live. I am going to be reading a statement that was written for me directly from staff at the FDA, was emailed to me via U.S. Senator Merkley's Field Director, Jessica Fields, who had submitted on my behalf a presentation called Lean into Keeping Americans Alive and Well that highlighted 15 yucca products and how 20 hazardous ingredients were tied to mental health issues and chronic disease from the yucca app. I am going to be reading the response from the FDA because this matters to all Americans, and I am proudly walking my talk of advocating for food safety to the best of my ability. I want to invite everyone to consider reading and signing my petition that will be in this post, as well as download that yucca app in EWG, and we can change our lives together. Consumer awareness and education is probably going to go a lot further than any possible act of Congress to have legislation passed to require a revision of the FDA product approval process. Though I do want to be proactive in my diplomacy and say thank you to the FDA, because it does seem like they are taking this seriously. Here is the email sent to me. Thank you for sharing the constituents' concerns. We appreciate the public's interest in FDA's nutrition and food and chemical safety work, and we'll take these recommendations. We'll take these recommendations under advisement. The FDA recognizes the growing and vitally urgent issue facing Americans, chronic disease, including diet-related chronic disease, and is acting where there is clear evidence supporting action. On the nutrition front, FDA recently took the next step in facilitating lower sodium in the food supply by issuing draft Phase 2 voluntary sodium reduction targets after Phase 1 is showing encouraging progress. We have also finalized an updated definition for the healthy nutrient content claim, as well as proposed front of package labeling. Such food labeling efforts can provide a quick signal to help consumers quickly and easily identify foods that can help them build a healthy dietary pattern. As for the safety of chemicals in food, FDA recognizes that there is also significant attention and concern around the presence of certain additives such as colors. During the public meeting we held in September on the development of an enhanced systematic process for FDA's post-market assessment of chemicals in food, FDA heard from a wide range of interested parties regarding ultra-processed foods, the chemicals they contain, and the potential role these chemicals may play in chronic disease. Congress, state legislators, and others have made it clear that food chemical safety is a priority we need to address. We agree, and we are committed to leading the way on food chemical safety. We are leveraging our scientific expertise and developing a more nimble and systematic approach to evaluating chemicals in the food supply. In particular, the agency now has an office specifically dedicated to post-market assessments and is developing a process for conducting post-market assessments of chemicals previously evaluated for use in foods, which was discussed at the public meeting in September. FDA uses toxicity and biological data, along with data to estimate exposure, to support regulatory decisions, allowing or restricting uses of substances according to our safety standard of reasonable certainty of no harm. This general approach assures there's an adequate margin between doses that can cause adverse effects and the exposure level in food. We note that the FDA has an open docket in which Ms. Wildbill, I was Wildbill when I submitted the report, now Vandenhouten, may be interested in submitting public comment on the development of an enhanced systematic process for FDA's post-market assessment of chemicals in food, which I did actually submit public comment a few months ago. And for any of you watching, please consider submitting public comment about any concerns around the chemicals that are approved in the foods and products that we're purchasing. And you can make your voice heard at regulations.gov, as well as consider signing the petition. It also says if Ms. Wildbill would like to contact the FDA on other matters, There's more information on how to do so. So we can all contact the FDA at their FDA webpage. I am thankful to U.S. Senator Merkley's Field Director, Jessica Fields, for streamlining my presentation to the FDA. I am thankful to the staff at the FDA for responding directly to me via U.S. Senator Merkley's staff. So it's a start, but really, I went to Washington, D.C., and I met with Senator Merkley's legislative correspondent and then with Senator Wyden's domestic policy and health issues staff. And really, the shift is going to be in us as consumers, consumer awareness, consumer education. There's limited legislation that our elected officials can present. And I think the conscious shift in America has to be for us to empower ourselves. Start scanning, download the Yuka app and EWG. Apps like EWG and Yuka are going to absolutely revolutionize the American healthcare system, because consumers are going to be the ones scanning their products, saying what they're going to purchase and what they're not. So I want to encourage buyers at Safeway and Walmart and any major stores to please continue to order in the healthy UPC choices. I'm thankful Walmart and Safeway do have healthier UPC code choices. So let's just keep scanning. Tell people about Yuka. It changed my life. I've gone from 167 to 148. Anything under 50, skincare, shampoo, toothpaste, I'm doing my best just not to purchase it. So may we be well, and remember, the choice is up to us to live well and to free ourselves to the best of our ability from chronic disease in at least the way that we can, by making conscious, healthy choices when we purchase items by scanning. We can't know the truth about the scientific research data unless we scan. Thank you for hearing me, everyone, and please consider signing my petition and sharing this video. Bye.